Hi, I'm Bani Azari, and I'm a genetic cardiologist. Knowing your family history is important because it helps us identify risk for different cardiac conditions. And this can help us create a tailored prevention plan for your health. It's most relevant to know the medical history of your family members that you carry the most DNA with. So that's your parents, your siblings, and your children. We call these your first-degree relatives. Women should be aware that they have the same risks for inherited cardiac conditions. Most of these are inherited through autosomal dominance. So it is rare that we have cardiac conditions that just go with the men or the women in the family, but it's essentially the same for men and women. So if your father has a cardiac condition, you should be just as concerned for your health as you would for your brother's health. Women should also know that they are not silent carriers for what we know as the X-linked conditions, such as muscular dystrophy or Fabry's disease. While these conditions can be rare, women used to be thought of as silent carriers, but they can actually develop symptoms and findings for these diseases that can be milder or at a later age. Family history, or your genetic information, is just one component for your health. Lifestyle factors have a huge role in working with your genetic predispositions. So genetic predispositions create the roadmap for your life. Lifestyle factors influence how severe any cardiac conditions you can have, when they can develop, as well as knowing your genetic risks can help us determine ways to prevent them. Maybe you need to exercise more. Maybe you need to sleep more. Maybe there's certain preventions that you need to do by avoiding some medications. Starting with genetic testing, you need to start out by knowing your family history. There's certain red flags we look for in knowing who should get a genetic test. People with cardiac conditions, especially ones at early ages. So someone who has a sudden unexplained death in the family at an early age. And early age means under age 45. Someone who has an early heart attack. People who have early abnormal heart rhythms. Those are some of the red flags that we look at. If you have a family member that has a heart condition that had a genetic test that was positive, that's something that you should come to your doctor and say, I had this family member who had this test and I should come for what's known as cascade testing. Whenever a patient comes back with a positive genetic test, we always find this to be so helpful because now we have the reason for why they have their genetic condition. And this information can really empower our patients, and it can empower them to know what they need to do now to prevent their condition from possibly getting worse, to prevent sudden cardiac death, and also ways that they can screen their family members before any findings of disease to see who needs to also be monitored and treated early to prevent or even just modify this condition, and which family members we don't need to follow. In many cases, someone doesn't have a good family history. Either they were adopted or they were brought up by non-biological relatives. So in that case, we don't have much to really go on. We can look at overall risks, and sometimes we can also take their clinical information in addition to maybe their cultural ethnic background, if that's known. Not everyone knows their family history or their family medical findings. There are certain individuals in every family that seem to be the key pinpoint person who has all the information. And I would highly recommend that if you don't know your family's medical history, find out who in your family does. It may be your mother. It may be your aunt. It may be your mother-in-law. Having this information spread across all family members can really be helpful and powerful for your entire family. Not all cultures is it common for people to talk about their medical health or their family history. And if this is the case for your family, I'd like to help you make it more comfortable. Maybe it's not something you speak about at the dinner table or family gatherings, but maybe something that you could start to engage with other family members more on a private level so that they would feel more comfortable. But it's important that we get that information out so that it's not just sequestered in individuals, but able to help other family members as well.